Good evening, everyone, and welcome to this webinar regarding the Regulated Health Professions Act, which we'll be referring to as the RHPA. This session is designed to help registrants better understand what the RHPA is, the general framework of the RHPA, the process to move the pharmacy professions under the RHPA, what the Reserved Act's model of regulation is, and how a health profession receives authority to perform a Reserved Act, and how it will change the regulation of both pharmacists and pharmacy technicians in Manitoba. I'll now turn off my video feed just to reduce the load on the bandwidth. As we come together this evening, the College of Pharmacists of Manitoba acknowledges that we gather on Treaty 1 territory, the home and traditional lands of the Anishinaabe, Anishinaabe, Dakota Aote, and the Denisili Nations, as well as in the national homeland of the Red River Métis. We recognize Indigenous peoples' enduring connection to this land and commit to cultural humility within our regulatory practices. By embracing the diversity of knowledge within these communities, we strive to cultivate a culturally responsive pharmacy profession that meets the unique needs of all people living in Manitoba. Before the presentation begins, I'd like to share a few logistical notes. Attendee microphones will be muted throughout the session. If you have a question during the meeting, please use the Q&A feature located in the webinar control bar, typically found at the bottom of your screen, to submit your question in typewritten form. Attendees are invited to submit questions at any time using the Q&A feature. We will address as many questions as possible at the conclusion of the presentations. Questions will be read out loud and answered through the audio feed. If time does run short, any questions that are not addressed during the presentation will be answered in written format, posted along with the recording on the CPHM website. CPHM is pleased to welcome two representatives from the Canadian Association of Pharmacy Technicians, CAPT, which is the national advocacy group for the pharmacy technician profession in Canada. The first is Sheena Dean, president of CAPT. Sheena is a registered pharmacy technician with over 35 years of experience. She was among the first technicians registered with the Ontario College of Pharmacists in 2010 and currently manages the dispensary at Kristen's Pharmacy in Southampton, Ontario. Sheena has served on the board of directors for CAPT since 2001. In 2022, she became the first pharmacy technician elected president of the Canadian Council on Continuing Education in Pharmacy, CEAP. Her leadership and advocacy continue to advance the pharmacy technician profession across Canada. I would now like to invite Sheena to say a few words regarding CAPT.
The Canadian Association of Pharmacy Technicians was established in 1983. It's a volunteer-run, not-for-profit national organization dedicated to advocating for and promoting the profession of pharmacy technicians in Canada. CAPT's primary mission is to be the leading voice for pharmacy technicians, empowering them within the Canadian healthcare system. The organization's goals include advocacy, promoting the pharmacy profession as a whole, education, informing the public and other healthcare professionals about the scope of practice and importance of pharmacy technicians, professional development, offering networking and professional development opportunities for its members and other pharmacy technicians, collaboration, working with its members and stakeholders to enhance the profession. CAPT supports its members by providing a platform to stay informed about changes in the profession, access to educational resources, and connecting with their peers. The organization's work is crucial in shaping the future of pharmacy technician profession in Canada. Thank you, Kevin.
Thank you, Sheena. Also with us this evening is Susan Balagas, Director of Membership, CAPT. Susan Balagas is a pharmacy technician with 35 plus years of experience. She has worked in community pharmacy, education, and currently serves as the compounding supervisor at the Compounding Pharmacy of Manitoba. Susan has been a longtime representative for CAPT in Manitoba and has organized the Manitoba Pharmacy Technician Conference for over a decade. She has contributed extensively to CPHM through committee work and exam development and continues to advocate for the advancement of pharmacy technician. Her dedication to education, quality practice, and professional growth reflects her deep commitment to the pharmacy professions.
Thank you, Kevin, for that introduction, and welcome everyone. As the Pharmacy Technicians of Manitoba prepare for regulation under the Regulated Health Professions Act, professional representation is more important than ever. CAPT recognizes the value of pharmacy technicians becoming a regulated profession in Manitoba, as regulation is in place in other jurisdictions within Canada. CAPT supports pharmacy technicians pursuing regulation, and CAPT will work with and support the College of Pharmacists of Manitoba and the Regulatory Reform Project to achieve regulation as a health profession within our province. Being a member of CAPT means staying informed about regulatory changes. It keeps you connected and empowered to influence the direction this will all take. CAPT membership equals strong representation. CAPT helps to ensure that pharmacy technicians are recognized for the essential role we play in healthcare delivery. Tonight, I invite all Manitoba pharmacy technicians to join CAPT to demonstrate that the technicians in our province want to be included in the Regulated Health Professions Act. As part of the process, the government reviews association membership as proof that the pharmacy technicians are actively engaged in their profession. The lack of membership from Manitoba may impede the process to full licensure. To join CAPT, please visit our website at www.capt.ca. If you have any questions at all about this, feel free to email me at my capt.ca email. Thank you.
Thank you, Susan. I would now like to introduce the consultants who will lead CPHM through its regulatory reform process. Liz Ambrose has supported regulated health professions under the RHPA since 2013, following a 25-year career as a registered nurse and a decade as a senior nursing policy analyst with Manitoba Health. She has played a key role in drafting regulations for multiple colleges and played an essential role when she worked for the legislative unit of Manitoba Health, drafting the Regulated Health Professions Act overview and guidance documents. Since retiring from government, she continues to consult with health profession regulators on reserved acts and policy development. Leanne Mathis has worked in healthcare regulation since 2008, including leading the College of Registered Nurses of Manitoba's transition under the RHPA. Since retiring from the CRNM staff in 2021, she has consulted with several Manitoba regulators to draft regulations, bylaws, and governance policies. Her extensive experience with government and regulatory bodies positions her as a key leader for the Regulatory Reform Project. I now invite Leanne to present part one of the webinar, the framework of the Regulated Health Professions Act.
Thank you, Kevin. It's an absolute pleasure to be here this evening. I get very excited about the RHPA because it's been a while coming, and it's interesting work, and it will be, I believe, a good thing for the pharmacy professions. So tonight, I would like to provide a general overview of the Regulated Health Professions Act and highlight some of the differences between the RHPA and the current legislation in order to give you some insight into the changes that are required to move under the RHPA. And in moving under the RHPA, we call it, technically, it's becoming governed under the RHPA. So in terms of the current status, you can see this is not new legislation. The RHPA was passed in 2009 and proclaimed in 2014. So far, only 5 regulators are under the Act out of a possible 21. It's not a quick process. The you can see the colleges under the currently under the Act. And there are approximately 4 or 5 more colleges that are quite close and may come under in 2025, 2026. The CPHM is now on the official list of colleges to be brought under the RHPA. So that's why we're here today. We just want to start to familiarize you with it more than anything. So in terms of the principles of the RHPA, the RHPA commitment is really to and to bring it forward, the idea that the commitment of regulators to the protection of the public as their primary mandate. Most regulators, including pharmacy, came out of guilds or associations, and over time, the functions of protecting the profession has been handed over to the associations. So for pharmacy, that's MSP, the Manitoba Society of Pharmacists, or now known as Pharmacists Manitoba. And the college has been the primary protector of the public. The RHPA is clear on the mandate of public protection for all healthcare regulators. The RHPA is umbrella legislation, and while currently the CPHM is governed by the Pharmaceutical Act and regulations, the RHPA will be the act for all healthcare professions, and each profession will have its own regulations, bylaws, and policies. The model of legislation brings consistency across professions in order to make it easier for the public. Previously, for example, if a person were a member of the public, were looking at the complaints and discipline processes, now called the complaints investigation and inquiry processes, they would find that every act for each profession had a slightly different process, and the language was different. So it wasn't helpful for the public. This move creates consistency of language, and it really speaks to the public. It also provides a move to, yeah, if you could just back up one slide, please. Thank you. I know I got ahead of myself. It also moves to a reserved acts model, and the idea that no one profession owns any one reserved act. So each profession, there will be overlapping scopes of practice among all of the professions. It also speaks to interprofessional collaboration, which no other legislation so far has done to this point. And we all know nowadays, especially post-COVID, we need all professions to work collaboratively in order to ensure patient safety and timely access. And eventually all regulators will transition under the RHPA. Next, yeah, thank you. So some of the major language changes under the RHPA, for example, one of them is, and I mean, CPHM has actually, their legislation is relatively new. So the board has already become council. So that is something that all regulators will move to, away from board to council. Complaints committee will become the complaints investigation committee. The discipline committee will become the inquiry committee. And there will also be practice directions, which have the force of regulation. Now, CPHM already has these, but it will go across all of the professions. So the reserved acts, now Liz is going to go into this quite a bit more in depth, but just basically the idea that reserved acts are procedures which have the potential to cause harm to the patient if not performed by a competent, regulated healthcare professional. And the reserved acts are nice because they assist in further defining the scope of practice by actual procedures. They are shared among the professions, and the depth and breadth of reserved acts will vary by profession. And Liz, as I said, will go into this in greater depth. The RHPA sets out the duty to serve the public interest, as we've discussed. It also says a college must not set professional fees for service. So, for example, in the pharmacy context, the CPHM may not set dispensing fees, or I know that there's probably another word for it now, but that's what the lay people call it. And for example, for physicians, the College of Physicians and Surgeons may not set up a fee schedule. So the RHPA sets out certain requirements. Annual general meetings must be once per year. There's a minimum trigger for special general meetings at 5%. It sets out the council composition, and the idea that council may not have more than 11 members, and that each council must have a minimum of 1/3 public representatives on council. And I will tell you that the trend is to increasing that number across the country and around the world. Terms of office, no council member may be on council for more than 12 consecutive years. And it sets out the idea that certain statutories committees must be struck, such as complaints, investigation, and inquiry. So these are just some of the highlights of governance. Registration, not so different from what you have now. There will be a certificate of registration, which is a one-time document, does not allow the holder to practice. It simply says that at one point in time, the holder of the certificate met the initial requirements for registration. The denial of a certificate of registration may be appealed to council. A certificate of practice, which is what you are all mostly familiar with. You renew it annually. It allows you to practice subject to any conditions noted. And again, a denial may be appealed to the council. The RHPA stipulates that the standards of practice and the continuing competency program must be written in the regulation. The code of ethics may be incorporated by reference if it's a third-party document. For example, the National Alliance has code of ethics, and the nice part about this is you simply refer to the title of it in the regulations, and as it changes, you don't need to rewrite your regulations. So it's kind of a nice little trick they put in there. So that's that. Complaints and inquiry committees, very similar to the current Pharmaceutical Act. The ability for the registrar to assume the duties of the complaints committee regarding the investigator function. This helps to move things along. Often one of the big complaints from the public is, I've had this complaint in for 2 years and nothing's moving. And this helps get it started. The subsections 104.3 and 129.3 restrict the publication of information regarding an ailment, emotional disturbance, or addiction that impairs the member's ability to practice. But they did put in a provision for instances in which the public interest substantially outweighs the privacy interests of the investigated member regarding inquiry panel findings. Now, these, I must say, are few and far between, but there are instances, sometimes in significant cases, where they will invoke this section. So there will be 2 regulations under the Act to establish the college. The practice regulation, which sets out the professional scope of practice and the reserved acts. And then there's the general regulation, which is the one you will refer to most often. And the general regulation kind of reads like your current act and regulations. It sets out the registration and renewal requirements, conditions for performance of a reserved act, standards of practice and continuing competency program, those sorts of things. So the big question is, how do we get there? And CPHM will work with myself and Reserved Acts consultant Liz to complete the required preparations. The goal will be to establish 2 independent pharmacy professions under one college. So the pharmacists and the pharmacy technicians, And the college will be renamed to reflect this. The name hasn't been set yet. Trying to make sure we get the right language. There will be two parallel processes in becoming governed. One will be for each profession. There will be a regulatory reform ad hoc committee, which is in the process of being formed as we speak. And there will be two Reserved Acts working groups, one for each profession. And the timeline is we have a goal of 2027, and I must say that is largely dependent upon government. And, it could be anywhere, it could even be late 27, early 28. We just have to be nimble.
Well, thank you very much, Leanne, for the overview of the RHPA. I'll now turn it over to Liz, who will walk us through the concept of reserved acts and the submission process within the RHPA framework.
Thank you, Kevin, and good evening. Tonight, I will provide a general overview of the RHPA Reserved Acts and submission process, as well as an outline of the CPHM project with a preliminary timeline for the work. Some of this we have gone over, but this part will probably be in a little bit more depth in terms of the timelines and and obviously the work of the Reserved Acts Working Group. In Part 2 of the RHPA, the list of the Reserved Acts is set out in this section of the Act, along with describing their purpose, providing definitions that apply to the Reserved Acts, who may perform a Reserved Act, and the requirements for the delegation of a Reserved Act. As previously noted, the regulated health professions in Manitoba are gradually being transitioned to two regulations under the RHPA, the Practice Regulation and the General Regulation. When completed, all 21 statutes for the 22 regulated health professions will be replaced by the RHPA. Each new regulation is profession-specific and will set out what reserved acts the profession can perform and any limits or conditions on the performance of the acts by its registrants. The Reserved Act model of the RHPA sets out a new way of regulating the provision of health services on the concept of controlling potentially dangerous acts. British Columbia, Alberta, and Ontario have similar legislation to the RHPA with the reserved or controlled acts or activities model. The ability to perform the reserved acts is not exclusive to a particular health profession, and so, as Leanne had noted, there will be an overlapping and sharing of reserved acts by the professions. It is intended to support interprofessional practice and increase access to healthcare services while protecting the safety of the public. Under the RHPA, the scope of practice of a health profession is established through what is called a non-inclusive scope of practice statement and the reserved acts authorized for the profession. A non-inclusive scope of practice statement is intended to overlap the professional boundaries and are accompanied by controlled or reserved acts that the profession has the education and clinical competencies to perform them. Entry-level competencies are the competencies acquired from the education program, and these form the basis for determining the reserved acts. In addition to the practice environment and additional education, they will also be included in the context of the reserved acts being requested by a profession. To perform reserved acts in the course of providing healthcare, legislative authority must first be granted to a regulated health profession, and this is done by the health profession demonstrating that its registrants are competent to perform them. Using set criteria that has been established by Manitoba Health, each regulated health profession must provide a submission to Manitoba Health that requests the authority to perform a reserved act and demonstrates the competency and appropriateness of its registrants to perform the reserved acts being proposed for the profession. The next two slides set out how the reserved acts are developed and sort of in a step-by-step process. First, the reserved acts, identifying from the list of reserved acts to be requested for the authority to be performed by the profession. They have to be identified and addressed initially. Next, when reviewing those reserved acts, determine if there are any conditions or requirements to perform the proposed reserved act by the profession. Third is then gathering practice data and practice examples from registrants to validate and provide context for each of the proposed reserved acts that are listed. Fourth is demonstrating the required competencies of the profession, and this is done by providing a link to the national competencies, as well as a listing of the didactic and clinical courses of the education program to demonstrate the entry to practice competencies relevant to the reserved acts being requested. Fifth is compiling a jurisdictional scan that demonstrates if and how the proposed reserved acts are performed by the profession in the other jurisdictions. And finally, consult as appropriate with other relevant groups, stakeholders such as employers, clinical practice groups, other regulators, etc., to inform them of the reserved acts being proposed and gather feedback to support the submission. These are all the criteria that are required in a submission that which will eventually go to Manitoba Health. So these are all prepared and these are all compiled then and listed into a document. And the reserved acts, once approved, are included as part of the general regulation, but the development and submission process for them is a distinct process from the other components of the work to transition to regulation under the RHPA. On average, it takes about 12 to 18 months to work up and complete a reserved act submission for one profession. So with the two professions, pharmacists and pharmacy technicians, it is anticipated the CPHM project will take about 2 years to complete. The first phase of the regulatory reform work is to identify the reserved acts to be requested for the profession, and of course then determine if there will be any limits or conditions required on the performance of them. Once the first step is completed, the remainder of the work is based on meeting the criteria as listed for the reserved act submission, and is completed in stages and based on gathering the necessary information. Finally, the work being planned to start is going to start with the pharmacist, while other preliminary work is being done for the pharmacy technicians in preparation for regulation. When ready, the work on the reserved acts will commence for the pharmacy technicians. Once completed, each profession will have its own reserved act submission to provide to government and will have achieved a major requirement to transition to regulation under the RHPA. The transition to move under the RHPA may take a while. It's heavily dependent on how quickly government moves. However, CPHM will aim to be ready in 2 years' time. Thank you.
Thank you, Liz, for that very clear explanation of the reserved acts and our proposed timeline for CPHM to move under the RHPA. At this point, we'll address questions that have been submitted through the Q&A app. The consultants will do their best to answer as many as they can in the time remaining tonight. As we may not be able to address all the submitted questions, CPHM will compile a list of the questions from today's session along with responses from the consultants. The Q&A session recording and slides from this evening's presentation will all be posted on the CPHM website.
So we have our first question submitted. Elaine Mahoney asks, are you also consulting with educators, for example, faculty and community colleges for their input? So I'll turn that over to Liz first, and then I'm sure Leanne will be able to contribute to the answer to that.
The answer is yes. One of the criteria that is required is demonstrating in the entry to practice program where the competencies are taught, and both in a didactic and clinical format. And so the education programs will be consulted in this process, and not just on the overall process. Each reserved act is dealt with separately and requiring the information for each of the reserved acts that are being requested.
And it's Leanne. Liz got it in one. I have nothing to add.
All right, thank you very much. So the next question, Patrick Fitch asks, is there opportunities in the future to make submissions for additional reserved acts as practice evolves?
It's Liz here. Yes, I mean, one of the real advantages of having umbrella legislation for the Act and then having each of the professions come in under regulation is that when changes need to be made, new procedures come into play, then you only have to go, you can make an amendment, but you're making an amendment to a regulation and not an act. So the amendment is worked up and justified and et cetera, but then to enact it, it goes to cabinet. It doesn't require the hearings and the readings, et cetera, that a legislative act would require. So they're much easier to amend and to add to.
And it's Leanne here. Also, Liz will be looking at the reserved acts from the perspective of the future as much as possible. So hopefully the ability to claim the reserved acts and have the depth and breadth sorted away will allow for certainly the medium term.
And now we'll move on to the next question. So Kyle Skayman writes, I'm unclear as to why this move is being brought in. Is there an inherent benefit to us? So I'm not sure if it Liz or Leanne wants to tackle that one.
I'm just wondering if this is coming from a pharmacist or a technician.
That
But
I'm not sure.
okay. I just wasn't sure if the question was coming in terms of what would be the benefit for technicians for being regulated, but I will address it broadly. And the idea is that while CPHM's legislation is relatively new, there are many other professions, of the 21 that some of them may have acts and regulations from the 1950s. So it's the idea, and some of them may be functioning as both a regulator and as an association. So it's not saying that necessarily CPHM needs to change what it's doing, but it's a provincial statute, so it affects all of the regulators in the whole province. So the idea is to bring everyone to the same level and then go from there.
Thank you, Leanne. Will the current listed pharmacy technicians have to write additional exams to become regulated? In Ontario, they had to undergo bridging courses. This comes from Elaine Mahoney. I'm not sure who wants to tackle that one. I would hesitate to guess that this will all come out with the work that is done with regard to the reserved acts and the scope of practice that is being requested under the RHPA. And so depending on how that aligns with the current training that is available in Manitoba, as well as how it aligns with training programs across the country, this is a question that will be answered in the future. It's not easily answered at this point, but certainly Liz or Leanne can jump in.
No, I think that's a good response, Lori.
Yes, I agree.
All right, and so moving along, we have a question from Stephanie Romas. Will additional schooling or exams be required to perform the reserved acts or just additional training?
The reserved acts reflect current practice. So it's not trying to you can, if this, depending on the profession and some aspects, which something like independent practice may have been in the wings but not addressed with the current legislation, that something like that would go under a change of scope. But for the Reserved Act themselves, they reflect practice. They reflect everything from entry to practice to advanced practice. And the conditions and the limitations that come into the Reserved Acts reflect that, changes that would come with experience and expanding scope as we get more experienced in our practice. So it really does. There will not be anything additional unless there is something selected in the Reserved Acts that will apply to, for example, I'm just thinking that there can be, because Reserved Acts will apply to everybody. And then some Reserved Acts, because of the technicalities or the conditions or whatever, will only apply to a very small number, possibly advanced practice. But so you understand what your scope is and where your limits of your scope take you to. So you have the ability to take that additional education if it's in that Reserved Act and take on a greater scope. But it addresses the Reserved Acts already address practice, which is entry to practice level up to advanced practice.
Thank you, Liz. We now have a question from Kara Plummer. As a registered technician, will I have the ability to work under my own license instead of being covered under my manager's insurance?
Yes, you will. The whole point of having pharmacy technicians come in as a regulated health profession is that it puts the accountability where it belongs. So if a pharmacy technician is doing their job, it's important that they're accountable for their work. If you're working under someone else, that person is generally officially accountable. So this is a much better method of ensuring accountability.
Thank you, Leanne. Now, Penny Sheffrin asks, does this mean that the Pharmaceutical Act and the current regulations, will be eliminated? Will the Code of Ethics and the practice directions remain?
The way it will work is that the current act and regulations will be rescinded once the college becomes governed under the RHPA. There are transitional provisions that will continue until, for example, if there are complaints that are in process during the transition, they will continue under the old act and regulations until they are completed. Any new issues will come under the new act and regulations. So there's always a little bit of continuing on with the old legislation, but for the most part, yes, the current act and regulations will be rescinded. The standards of practice, I believe the college, and Lori, you can correct me if I'm wrong, I believe the college has a committee working on the standards of practice right now, and the continuing competency program. So the standards of practice will be written into currently they will be written into the regulations, and the Code of Ethics, I believe will also it may well be brought in under incorporation by reference. Lori, correct me if I'm wrong in any of that.
No, Leanne, that is correct. Yes, there is a committee working on a continuing competency program right now. The standards of practice do currently exist in regulation. However, with the work of the working group to identified the reserved acts that will be requested for both pharmacists and pharmacy technicians. The scopes of practice, as Liz has pointed out, would have potential to, the standards of practice and scopes of practice would have potential to expand. We'll move on to the next question now. Will pharmacy technicians be considered licensed as opposed to listed? And if licensed, how will fees be affected? This question comes from Brianna Saganik. I hope I didn't butcher that name too badly. Apologies.
It's Leanne, and I'll start. The pharmacy technicians would be registered, not just listed. It would be, there will be a process in the regulations for registration and registration renewal. And I'm sorry, I may have forgotten the second part of the question.
So how does, how will this affect the fees that are paid by
Yeah,
pharmacy technicians?
I think that's to be determined at this point, Lori, am I correct?
Yes, and fees are always determined on a level of the amount of regulatory responsibility and services and et cetera that are required of a health profession. So it is likely that fees will increase once a profession becomes regulated. Pharmacy technicians are currently listed and so do receive a certain level of oversight by the regulator now, but that is certainly not considered full regulation. We'll move on to another question. The question is how, and this question comes from Christine Gazner. Gazner. How many Manitoba technicians are members with CAPT, and how many more are needed? So I'll turn that question over to Susan.
Hi. Yes, Christine, thank you for your question. So right now in Manitoba, we have 34 technicians on the list with CAPT. It is the second lowest membership in Canada. In order for government to consider us moving into the RPHA, we need to have a minimum of 50% of the technicians plus one. So right now we're looking at 125 technicians that need to be on the list. My meetings with government state that we need to have that number. As the official advocacy group that has applied for this with the College of Pharmacists of Manitoba, we need to have that number up.
Thank you, Susan. Another question from Elaine Maloney. Are you able to share any information on the expanded scope for pharmacy technicians?
It's just like right now, I'm not able to speak to that. We will, be looking into this more when we get to the reserved acts for the pharmacy technicians.
Liz, maybe you can speak a little more to the process, and so the extensive research that you do with regard to what the profession currently does in Manitoba, and then a comparison with regard to what pharmacy technicians are their scope of practice in other jurisdictions in Canada that are regulated.
I can't, right at this point, I'm not able to speak specifically to the varying scopes of practice. But I mean, there is the reserved acts as laid out by under the RHPA, the process is to go through each of them and pull them out initially for discussion and for review. I have not had a process yet in terms of the professions that I've worked with the varying legislation across the country, that there has been any real differences or setting precedent for them. I think there'll be a number of factors. Setting precedent is one thing, and what we want to do, the objective will be to obviously address and maximize scope in Manitoba, but also to have it reflective of the broad scopes across the country, and begin from a space where there, as much as possible, is included. But until we actually begin the process and start to have these discussions, it's difficult right now in order to hypothesize about, what exactly that will look like.
Lori, I can speak to this a little bit. So I'm sure many of you are aware that the scope of practice for pharmacy technicians has always been posted by the National Association of Pharmacy Regulatory Authorities, or NAPRA. Just recently, over the past year, NAPRA has contacted CAPT and asked us to keep the list up to date. So their list has actually been removed from their website, and we will be posting the most up-to-date list of all the scopes of practice of all the technicians across Canada on our website. All of that research and all of the development of that have already been completed on our end. So on the CAPT website, it should be up there sometime soon to show you what the scope is across the country for pharmacy technicians.
Thank you, Sue. We'll move on to a few more questions as we have time. So we have a question from Ron Goose. Will further expansion and implementation of pharmacist practice currently permitted under the legislation and occurring in other provinces as included practice remain on hold until pharmacists and technicians come under the RHPA?
Lori, I will, I've kind of come into this in the middle of this, but my understanding is that the college continues to meet with government in order to further the current list of activities that or practices that would allow for pharmacists to assist in the current workforce shortage times, I guess. So it hasn't been abandoned in the meantime, and it would simply any changes that were granted by government would be worked into the reserved acts under the RHPA.
Thank you, Leanne. We have a question now from Emily Gillingham. I saw something in the slides about an ad hoc committee for regulatory reform. Can you tell us more about that?
It's Leanne again. We are currently in the process of populating the committee. Basically the committee's purpose will be to review things before they go to council. So, for example, when we complete the workbook for the regulations, which basically says here's how the regulations would read, I would bring them to the committee and they would review them and add their professional input and perspective, and we would then bring them to council. So they're basically they're a bit of a sounding board for council, so that we can anticipate before we bring something to council what might be the questions, what might be missing, those sorts of things.
Thank you, Leanne. And now we have another question more related to pharmacists, again from Kyle Skyman. Does pharmacy lose any autonomy or fall under the control of governance outside of ourselves? Will we be giving up any rights or abilities? Will we be oppressed by other member colleges more or less than we already are?
I'll start. It's Leanne. Very little will likely change for pharmacies under the RHPA. I can't really address the second part of the question, but I can just say that I don't imagine much will change for the worse anyhow. If anything, I think it would be for the better.
Thank you, Leanne. So we have a question from Tassa I'm sorry about the last name, Padcusi. In any case, how can members participate in this process? I'll start out by saying that throughout this process, there will be many points of consultation. And so as the documentation and the drafts are developed at committee level and working group level, these will go out for consultation and for member comments, for registrant comments. And there are a number of points in this process to move and transition under the RHPA that government sets the requirement for consultations at a broad level with public as well. And so you're absolutely invited to participate in any of these consultations. The other aspect that I'd like to mention is that CPHM in moving through this process to transition under the RHPA is committed to providing information sessions like this one tonight. This is what we are planning as one of several. And as the work continues and the information is gathered about some of these questions that we don't have a lot of information at this point about, we will host other information sessions like this. And this session, as well as any others that we host, the recordings along with the slide deck and the FAQ that match the presentation will all be posted on the website, so registrants can go back and reference them at any time. Now, does anyone else want to add to that?
No, I think that was great, Lori. It's Leanne. And like you were saying, that there will be surveys, especially for the reserved docs that Liz will be working on sending out. And those will be really, really crucial to have a good uptake on those surveys.
Yes, once the reserved acts have been identified and the conditions developed along with them, the part of the process will be consulting with registrants in the form of gathering data on those particular reserved acts and practice data and practice examples. And those are our key elements of the submission that will go to Manitoba Health.
Thank you, Liz. I think we have a chance for one more question, and then we'll turn it back to Kevin for the final comments. So this question comes from Caitlin Hemeniki. Will the new Complaints and Investigation Committee under the RHPA be broad rather than profession-specific? Will this impact timeliness?
That is something that we haven't yet discussed, to be quite frank. I think that the committee could and probably will look after both professions. It will just likely be constituted a little bit differently, depending on the type of complaint. So I think if you look at, for example, the some of the UK complaints processes in the United Kingdom, they're going more towards one professional conduct process for any profession. So it certainly can be done, and it's just a matter of how it's constituted depending on the type of complaint.
Thank you, Leanne. And now I'll turn it back over to Kevin.
All right. Well, thank you all for joining us and for your thoughtful engagement throughout the session. The transition to regulation under the RHPA is an ambitious and important project for both pharmacy technicians and pharmacists in Manitoba. To learn more about the RHPA, please visit the CPHM website. CPHM will provide information regularly through Friday 5 articles and on social media. I ask you, please stay connected and informed. Look for anything that we send out, and really looking forward to your engagement with it. Have a great night.